Hello, I'm Dr. Charles Newby, and I'm located in Iron River, Michigan, which is in the heart of the Upper Peninsula, Michigan, and I've been about 30 years in practice. Our specialty in our practice is based on neurological work. I'm a clinical nutritionist. We like to work with challenging conditions and difficult cases that are chronic. So we've taken our opportunity to learn lots of treatments and analysis when it comes to fibromyalgia, headaches, learning disabilities, sciatica, herniated discs, depression, chronic back and neck pain, and also chronic fatigue. We also do a complete metabolic workup on people regarding the nutritional and other problems that they may have. We do a complete blood profile metabolic workup that consists of 25 chemistries. We do a full CBC and immune panel. We check the thyroid, we check for C-reactive protein, we look at liver enzymes and different minerals. We also like to do hormone imbalance testing. There's a lot of females out there with multitudes of problems, anywhere from difficult periods to different kinds of mood imbalances, menopausal symptoms. So we work with various specialties in that area too. We also work with the adrenals, which are done by the saliva. The saliva gives us a very good opportunity to check cortisol levels, DHEA levels, and to look at different people's stress levels and help them in that area. We like to work with a lot of different healthcare practitioners around the United States too. One of the areas that we've been working with, and that's with Standard Process Company, and I work a lot with Dave Roselak, who provides lots of training and health seminars to learn how to use various herbs and various whole complete food nutritionals that the company's been in business for since 1929, which is a very good solid company. One of the books that we use and have available for patients is the book on iodine, and this is by Dr. David Brownstein, who is a medical doctor that practices down in Lower Michigan. He has changed his practice dramatically from being a traditional medical doctor and has worked on a holistic level. I also work with Dr. Harry Eidner, who works with Biotics Corporation. He has developed this nutritional protocol manual over years and years of extensive research, and he also helps train doctors extensively on how to analyze and use blood chemistry evaluation. Another doctor that I have worked with that is down from Appleton, Wisconsin, and he has trained me in the neurological work and also decompression, Dr. Michael Johnson, and he wrote the book, What Do You Do When Medications Don't Work? A Non-Drug Treatment to Dizziness, Migraine Headaches, Fibromyalgia, and Other Chronic Conditions. And I also work with Dr. Janet Lang. She works with specifically restorative endocrinology, so she trains lots of doctors in the analysis of thyroid, adrenal, and different blood sugar and hormone evaluations also. I'd like to talk to you about non-surgical spinal decompression. It's a very valuable tool when it comes to patients that have herniated discs, bulged discs. Sometimes they might have degenerative discs, and this gives us the opportunity to use a machine like this to very gently and effectively actually pull these discs apart that can be herniated. What the traction table will do here, it actually works in a manner that it gradually brings the disc apart very gently, so it doesn't cause the muscles around the spine to tense or to fire. That would cause the muscle to counteract against that separation or that pull apart of the discs that we're trying to do. It occurs over a period of about 15 to 20 minutes, and what we do when the patient's on here, we normally hook them up to concentrated oxygen over here with our oxygen concentrators. The oxygen gives us an edge on healing of the disc, healing of the nerves, and it definitely gives us a much more benefit of getting better results with the procedure. One thing the procedure also does, as it pulls the disc apart very slowly, it creates more of a vacuum effect. The vacuum effect creates a negative pressure in that disc and actually sucks that herniation or pulls that herniation or bulge disc back into proper position. Also, what's very unique, as a lot of people don't know it, is the disc itself does not have a blood supply. It doesn't have no blood vessels. The bones that are above and below it, they do carry the blood. So a lot of times when that disc has degenerated or thinned out, that disc has lost its blood supply. The decompression itself, because how it opens and closes that disc space, actually stimulates blood flow back into that disc and actually helps to regenerate that disc. So it's very, very effective for all these type of problems. Sometimes you need this above and beyond a chiropractic adjustment, but we've had a lot of success. We have several patients that have given their testimony on the benefits that they've had from spinal decompression, and we'll be glad to share those with you.
My name is Joe Van Remorter. I live in Aurora, Wisconsin in the Iron Mountain, Kingsford area. My occupation is an accountant, so I have a desk job, but I also have a farm, so I do a lot of strenuous lifting, and I also have an outdoor furnace, so I lift a lot of heavy wood. I've had backaches off and on ever since I've been 18 years old. My original problem this time was sciatic down the left side real bad. When I tried about 10 different chiropractor treatments, 2 different chiropractors in my home area, and each time it got a little worse to the point where I could hardly walk anymore. So I came up to Iron River here to see Dr. Newby. Apparently I didn't look so good the first time I came in, so he wouldn't touch me until I had an MRI. So I had my first MRI ever, and it showed 4 torn and bulged discs, causing the sciatic apparently. Dr. Newby set me up for 18 appointments initially, told me there was a 90% chance that he could correct the bulged discs, and I've had 13 appointments so far, and as of the last appointment I've had no pain. I'm standing straight. I haven't felt this good for months and maybe years. To be completely without a backache the last 3 days. I've been able to sleep, which I couldn't either lay on my side, either side, when I had the sciatic. So I was referred to Dr. Newby by a grandson of my employer who had a similar situation where he struggled with a back problem for years, and within a couple of months he was squared around. So I thought it was worth a try, and quite frankly I was a little skeptical at first, and now I'm a believer. So I will be referring patients up here when I see that they have a back problem that they've been dealing with. So
yeah, with the ADP 400 Chattanooga decompression table, we can do decompression in the neck cervical region as well as the lumbar spine. So it is capable of helping spinal conditions, both lower and upper spine. One thing we like using in our clinic that is a very non-invasive light pressure type of treatment and adjustment is we use the arthrostim. Patients in the past have probably remembered, patients that have been to chiropractors before, I remember what we call the activator. The activator was a handheld, spring-loaded adjusting tool that you would have to give it several squeezes here in order to cause the instrument to make the adjustment. But a company called Impact, they came out with this product called Arthrostim. Now the advantage of the Arthrostim, it's very quick, and you can also adjust the tension or pressure just by the pressure of the instrument. What also I like about it, it's very fast. So if the patient tends to be very tense or they tend to tighten up, it'll actually beat their reflex. It delivers about 12 pulses per second, so it's very, very quick. So in order to give a little bit of an adjustment, you can go very, very lightly like this, on a vertebrae or a joint, or you can go a little deeper and create a much deeper type of adjustment. So this works very, very good for all types of the spine. We can use it for correcting knee problems, ankle problems, elbow, shoulder problems. There's a very, very unique type of shoulder adjustment that I did learn through the GRT seminars, Dr. Gonzalez, and I'm going to show you a little demonstration how we correct a type of a frozen shoulder problem, which is very common. And it's very, very quick, and it's painless, and you get immediate results. So first of all, you come underneath the clavicle like this, and you have the patient take a nice deep breath in, and as they're deeping it, breath in, we traction back on the shoulder, and they breathe out. And what we did here is we moved the clavicle upward like that, and then we come back here on the back of the scapula, and we move that inward and downward, and we'll have the patient deep breath in and all the way out, and that corrects the scapula in an inward downward movement. And then the last part of the movement, we take the bottom here of the arm and we go with a downward pressure. The patient takes a deep breath in and breath out, and we open that shoulder up. We then can come over to the neck itself and apply different depths of pressure to realign the cervical spine. Also stimulate these muscles for proprioception and to stimulate the muscle to start functioning again. After we're done with the arthrostim treatment, we take this cold laser device, it's red and infrared light, and we take this and we scan this right over the tissue. And what this helps, it helps to increase healing and upregulates the nerve to help hold this adjustment better. This is a form of light therapy, which helps many, many things as far as pain, inflammation, increasing blood supply. And we just apply this over this area, and that helps to hold that adjustment and keep that shoulder in a much better place. You can also use the arthrostim in many, many other parts through the spine and many other parts of the extremities like we talked about. Here we're demonstrating how we use the myovision. This is our surface EMG. What we like to measure on this, which helps us a lot for a chiropractic and spinal evaluation, we like to measure the tension of the muscle. What this mainly does, it actually measures the electrical function of the impulses of the muscle themselves. What happens in the spine if you have what they call a subluxation, or a bone out of proper position that could be pinching a nerve? The actual nerve itself can create too much energy or not enough energy, which in fact will direct itself to the muscle that's right along the spine. So a lot of times if you have a pinched nerve where the nerve is actually being over-electrified or overstimulated, we'll see more tension where you see the red lines up here. If you see a situation where the nerve is being pinched when the muscle's too inactive, you'll actually see a yellow or an underfunction muscle, and that'll tell us areas of the part of the spine that it possibly have subluxation or the spine could be out of place. One thing we like to do in our office is always check the foundation of the body, and that is like the feet. The feet are very important. A lot of people have reoccurring problems in their ankles and knees and spine because the balance of their feet are definitely not level like they should be. The way that we do it in the office is we use what we call the digital foot scanner. We have the person stand on the digital foot scanner that scans the bottom of their feet. We can also see if they have any dropped arches, any problems with pronation in their feet. And from that digital scanner, we can actually email that to foot levelers, and we make them up a customized foot orthotic like this that would be placed in their shoes. A lot of times the pronation problem or the supination problem that you can see frequently when you look at people's feet have a lot of problems with recurring adjustments. So we like to always make sure the foundation of the pelvis and the feet, knees and ankles are always level. This will really help with athletes too, as far as for different sports events. This would be an example of what pronation looks like. And what happens that you can see either from the front or the back, you see that the ankle rolls inwards. Now, not all the time the arch has to be dropped here, but if the ankle is rolling inwards, it displaces its change right in the bottom part of the leg, and it would also cause the knee to roll inwards, which then also cause the femur to roll in, which in turn drops down the pelvis. You can see how much imbalance that creates the spine. It can even create a scoliosis here and cause the shoulders themselves to be off level. But with the ankles in alignment and the arches in proper position, you can see that everything is level from the bottom of the foundation all the way up to the shoulders. So it's very important to address this and analyze this type of problem for stabilization in the spine and to help hold those adjustments long term. We're going to show everybody how the percussor works here. This is something that the patients really do like because it creates a lot of relaxation in their muscles. It works excellent for muscle pain, scar tissue. We also flush organs with this machine, and it also gets the tension out of the muscles, removes muscle spasms, and it also removes a lot of the waste products, the lactic acid waste products that occur from a muscle being tightened up for a long time. It works in a very gentle but very deep, and we're going to show you how many speeds it has here. It has about 12 different speeds, so we can go at various depths. So somebody that might be having a lot of pain and a lot of tightness, we can go very light and gentle. And somebody that where we want to get a little more deeper into the tissue, we can turn up the speed and get a little deeper there. So we're going to do a little demonstration on how that works. We're going to do some relaxation first of all in the top part of the back here. And with this type of unit here, you can go right into the muscle tissue. You can go right over the bone very gently. And like I said before, you can also flush different organs that where organs might be congested. Here we have a patient doing the upper body bike exerciser, and this is a great benefit when we're having to refacilitate and charge up the cerebellum. A lot of times when we do some of our neurological testing, we find that the cerebellum is not firing as much as it should be. Therefore, it's not getting enough fuel and oxygen. Now, we would call this fuel and activation. Now, the activation is through our patient here actually turning and working on the upper body bike. And what that does, it stimulates a lot of the muscles that fire right up into the cerebellum. The oxygen, as she's breathing this concentrated oxygen from our concentrator, that actually drives the oxygen from the bloodstream and helps improve the uptake of that oxygen into the tissue where it's needed, the brain, the nervous system. So we're bringing that oxygen level up into the brain and nervous system to help it heal faster and help it fire and function as best it can. So these things combined, called oxygen and fuel in activation, really make a big difference in helping all kinds of neurological problems, especially the cerebellum. This is what we call a hydromassage table. It has very warm water in it and it has pulsating jets. Actually, it's called a dry massage, hydromassage. You don't need your bathing suit for this. But what it does, it stimulates and relaxes the muscles very gently. It helps to also move a lot of that waste product out of the muscle tissue. So sometimes a patient may come in and they may be very tight and tense, and we'll have them first have a hydromassage treatment before their treatment or adjustment, and sometimes they'll have a hydromassage treatment after their adjustment. It helps relax those muscles and get the tension out of there, so it helps to hold their adjustment much better. Sometimes people fall asleep on here most of the time. Yeah, this is what we call the spinalator. It's also known as intersegmental traction. What it has inside here is a set of rollers that go up and down the spine, and what it does, it actually tractions the spine and it exercises the different muscles around the spine. It also does some mobilization, so the spine that is very fixated and tight and stiff, it'll help relax and loosen that too. It creates a lot of circulation movement too, and it works really good with the muscle and ligaments and helps conform to different parts of the spinal curves. So patients really enjoy this a lot, sometimes before their adjustment, if they're very tight, to help loosen them up so they can have a better adjustment, or otherwise sometimes after their treatment or adjustment, which will help stabilize and keep their adjustment holding better. This is our deluxe chair massage, and what I like about this, it totally works the whole body, the ankles, the calves. It does vibration. It actually feels like somebody's actually massaging you. It kneads the spine, it stretches the spine, and it gives the spine a full relaxation. We also use this before and after an adjustment. So it does help relax the muscles to help hold the adjustment, and it may even help loosen those muscles up to help the adjustment do much better. Our clinic specializes in spinal rehabilitation. We are certified in the Chiropractic Rehabilitation Association. What we like to do after we've worked with a patient for a period of 4 to 6 weeks, we like to get them into the rehabilitative clinic here and do some range of motion, stretching, and some improved muscular strength to help stabilize and hold their spine together. One thing we do use is we use the Body Masters equipment here. Each one of these equipment is designed for a specific part of their spine or a specific part of their frame, and each one of these are designed to fit to the exact patient's need. We have a range of motion limiter. We can also set the amount of weight and design the machine to fit each person specifically. So usually after we get done with spinal treatment and adjustments and the patient is out of the acute phase, we get them into the strengthening part of their care. This will help increase their muscular strength to protect their spine and hopefully avoid another injury. So we get the patient in here from anywhere from 4 to 8 weeks after their initial chiropractic adjustments. This is one of our pieces of equipment that a lot of our patients really like. This is called our flexion distraction table, also called as a Leander table. And the advantages we have with this is the ability for the lower part of the spine to be moving up and down. Now what that does, that opens up the joint and it stretches the muscles, and it gives us a very good mechanical advantage for actually adjusting the spine. A lot of times when we're working on somebody's spine and just stretching it and getting ready to move the vertebrae back in position, sometimes the vertebrae actually just kind of drops into place. So it's very relaxing, and we have a lot of people lay on here ahead of time before their adjustment, loosen up their muscles, stretch their muscles, and we get a much better, easily performed adjustment. Well, we'd like to thank you for taking the time to look at this DVD and our office tour, and also the treatment procedures that we offer you, and all the different types of chiropractic techniques and different techniques that we've learned over the course of our years. We'd sure like to have you give us a call, and our website is www.newbydc.com, and our phone number is 906-265-5175.